Hey friends, welcome to the Johnson City Living Podcast, where we learn about the people, places, events, and flavors that make Johnson City just a lovely place to live. I'm your host, Colin Johnson, with the Colin and Carly Group and Keller Williams Realty. If you're interested in buying or selling a home in the area, or if you're looking at investing in a rental property, give us a call at 423-930-8003, and we will look forward to helping you. Now, let's get to today's episode. I'm super excited for you guys to get to meet our guest, Miss KT Moyer with Homefront Physical Therapy. Welcome to the podcast.
Thank you. I'm happy to be here.
I'm super glad that you made it to the podcast. And I mean, like, it's a small town, right? And
yes.
I walked in and I was like, hey, I'm Colin. You're like, yes, we just met over at some friends' Christmas party the other night. Yeah. And yes, we did. And so I'm glad to see you again and get to talk to you a whole lot more, which is going to be good.
Yes.
So first things first, Johnson City Living, what do you love most about living in Johnson City?
So I like the things to do.
Yeah.
Not many people will say that because they will say, go outside for things.
They say Four Seasons. They say low cost of living, taxes, people, mountains.
Yeah.
Those are the big ones. Mountains.
I like the things that are available. So I came from Cleveland, Ohio.
Okay.
And I was very much a city girl.
Mm-hmm.
You know, I mean, just...
Cleveland's pretty big, right?
Yeah.
A couple million people?
Yeah. And I was in the suburbs, you know, and so, yeah, I was not an outdoorsy kind of person. And when I moved here, I became one. So...
That's good.
Yeah. I love being outside and just doing things that I would have never done in Ohio.
What can you not do in Ohio that you can do here?
Well, just that I never did in Ohio. You can, but like the mountains, like hiking and stuff
No
like
mountains
that.
in Cleveland.
No, it's so flat.
Yeah.
Now, and lakes too. So I've always lived near a body of water, like Lake Erie. I moved to Alabama for a little bit, so we were on the Gulf Coast.
Yeah.
And, you know, that's where I finished my bachelor's. But I'm always near water, and there's so much water, like bodies of water here. So.
We do have lots of lakes.
Yeah.
And they're all beautiful. And all unique and a little different, which is kind of cool.
Exactly.
Okay.
So I love it here. We've been here since 2008, so we're staying. We're not going anywhere.
That's cool. So tell me a little bit about your business. What's the name of your business?
Homefront Concierge Physical Therapy.
That's a mouthful.
It is.
Tell me about the name. Why Concierge? How do you guys operate?
So the name was actually founded, I had an idea for a physical therapy business that was, you know, more, we were going to call it frontline. That was, you know, on the front lines of pain, you know, kind of that scenario. But concierge, meaning like we go to people, was the premise of the startup, you know. And so I was trying to bridge the two together, frontline and some concierge going to their homes.
Mm-hmm.
And so Homefront kind of stuck.
I kind of like it. Yeah.
I know, yeah. And, but we're not just physical therapy. So there might be a rebranding of just Homefront Concierge because we do massage as well.
That's good. So what's the major portion? So is it 50-50 or are you guys more PT or?
Well, so we've grown to now 3 massage therapists.
Oh, wow.
And there's 2 PTs,
okay.
Myself, and I have another PT who primarily does concierge. So in the beginning, I was just doing it all in office and then going to people's homes if needed.
Mm-hmm.
And then as my schedule grew, the business grew, it was really hard logistically to
be everywhere.
Go to the, yeah. And so, I've got a team now. So
that's fine.
We're growing.
Yeah. Tell our listeners a little bit about physical therapy. I had never been to a physical therapist till my back started hurting about 2 years ago. And so I started going and it's been amazing. I'm like, you guys do wonders, miracle workers.
Well, you know, I wouldn't go that far.
I mean, I don't know. Like, Mitch and I would agree. We both, I see him there occasionally and yeah, it's been good.
Yeah. Well, so I've been a PT. I came here for ETSU to go to PT school.
Okay, so you went here at ETSU?
Yeah.
Oh,
yeah.
Go Bucks.
I know, yes. And so I've worked in this area in the outpatient world, you know, for now 13 years. And I was just fed up with healthcare in this area. And I was fed up with the traditional outpatient setting. We call it the mill, which you guys have been to PT. So I'm sure you've experienced one PT to like 4 patients at a time. And it's just a madhouse. And I really invested in my education. I kind of went through the equivalency of like 2 residencies. And so one of my specialties is a McKenzie therapist, which means nothing to most people. But the way I treat, I really dive into like the mechanics and the root cause of what's going on.
100%.
But when in a busy mill setting, you can't invest that time. And it's just too hard. And, I was stressing
more
myself
just
out.
triaging the issue, but it's going to come back later. And
Or just the quality of care in the mill is just very poor. There's days where you get maybe 15 minutes with the actual therapist, and then you're passed off to either exercise by yourself or, a student is taking you through. And I'm talking like an undergrad, not even a PT student. So
Gotcha.
it was frustrating. And, then a pandemic hits and things were a lot crazier in healthcare. And so I was fed up and said I could do this better myself.
Yeah.
And so Homefront was born. The Concierge was just to get out of my non-compete since I couldn't do a brick and mortar. But it also served a need because there's so many people who I can't make it to my appointment. I don't have childcare.
I'm old, right? I can't. Yeah.
And so I always knew that that should be
home health issue. Yeah.
A portion. But the biggest factor is I went out of network with insurance because I wanted to focus on quality and superior quality and service. But you can't do that in the traditional setting because of insurance.
Okay.
And so.
So does that mean you don't take insurance?
I do not.
Okay. Well, talk about this is just me asking questions because they come up. What would be like a typical service fee for our listeners? They're like, okay, to have her come to my house or for me to go to your office.
Yeah.
What's that look like?
The in-office fees and the concierge are a little different based on travel. But
sure.
The in-office fees are $165 for the initial evaluation, and then any follow-up visit is $125. And the nice part about it is it's all inclusive.
That's very reasonable.
There's no added fees. And I purposely wanted to make sure, because I know our demographics, I know our socioeconomic, and I wanted to make sure that I can still provide a living for myself, but also I'm accessible because I think what I do is important for everybody.
100%.
But yeah, and so everything's inclusive because I am a crazy budgeter, and so I hate surprise bills at the end, and healthcare is notorious for that, to where you think, insurance is covering this.
Yeah.
And then you get a $2,300 bill at the end and you're like, what? So, so flat rate billing, upfront cost.
Keeps it simple for you too. It's just and the client knows how much they're paying. And
yeah.
That's cool.
I will say, I can get real nerdy with insurance and how it works, but if you have a high deductible plan, a lot of times you're paying out of pocket. And that deductible is $6,000 to $10,000.
This guy, that's what Carly and I chose to do. Yeah, keep our monthly. Because we rarely go to the doctor, so
exactly.
It makes sense.
But PT doesn't follow the copay. We're co-insurance, and so you pretty much have to meet your deductible before they even pay for anything. So a stint of physical therapy out of network is actually more likely going to be cheaper.
Yeah.
But then you get the perks of your one-on-one. So it's just me and my patient for the entire hour.
Okay.
And so you get more personalized care. I'm more efficient because I can listen and understand what's going on.
And you're right there. So when the thing goes off or whatever, you're right there to start the next therapy or whatever.
Yeah. And then of course my skill set, I do a lot of hands-on work, manual therapy, dry needling and stuff like that. And so you get so much more and it's still affordable, if not cheaper, than going through those mills, as I call them.
Lovingly call them.
Well, sure.
Talk to us. My wife, Carly, had a shoulder thing, neck thing. She had a lot of dry needling done.
Yeah.
And she talked to me about it. But talk to the listeners about dry needling. What is dry needling? It sounds just horrific.
Yes. Well, so I'm terrified of needles.
Okay.
But I will say it is life-changing.
Is it a lot like on the acupuncture realm?
Well, so the only similarity is the needles. We do use acupuncture needles, but we use an anatomical model. And I will say my school of thought that I was trained through was called integrative dry needling. And so the only similarity is that sometimes if your shoulder is hurting, I'll dry needle your shoulder anatomically, like the muscles that are tight or whatever, but I'll also follow along the pathway of the nerve that innervates that area. And then I'll also dry needle the spine, again, that nerve root segment that correlates to that area. And so, but sorry, I'm going to get real.
No, I love it. Yeah, it's great. No, I'm listening and I'm like, yeah, this is cool.
But so the dry needling, so it uses acupuncture needles, and the disruption of the tissue is enough to stimulate your body's natural inflammatory response. But, everyone thinks of inflammatory as like the bad thing.
Right.
But it's actually a good thing. It's your body's natural repairing system. But it's a tissue disruption to stimulate that process, but not enough that is actually causing tissue damage.
Gotcha.
So it does bring blood flow to the area, but it's the good kind, those healing mediators that, help at a cellular level. And it speeds up the healing process. Also, if you have a trigger point within the muscle, I use the analogy, imagine like you have a handful of Twizzlers and one of those Twizzlers is tied in a knot. That's like a trigger point within your muscle.
Yeah.
And that tissue disruption with that needle is, again, not enough to damage it, but it releases that knot. Yeah. And then when we go along the nerve, it'll also desensitize the nerve to control the pain, like the pain signal, so to speak.
Do you do tens on those as well?
I can, yeah.
To like kind of really...
It just depends on like...
what you feel like the person needs.
Absolutely.
How deep it is or something. We go to see a guy who's a neuromuscular massage guy, and he's fantastic. But he says all pain is just blockages in the pathway, neuro pathways or energy pathways, and so it's if you can get that open, get the flow going, the pain typically goes away. I don't know if you'd agree with that, but
there's a whole lot more to it. But yes,
that was his like, hey. I'm talking to Colin. He won't understand a whole lot more than
that.
So.
Right. Well, I have a ton of analogies for like how to describe my nerdy things to like everyday people. And I do a lot of teaching. So I am a clinical instructor for ETSU. So students will like be learning with me and like learning how to treat and like, like practicals. And it's funny because they use such big words because they're all fresh in it. I'm like, you're going to have to dumb it down like for me. So, but I use a ton of analogies like the Twizzlers.
Sure. That's a good one. Yeah. Yeah, I think it's just pretty cool the way the Lord made the body and how we work. And it's super neat. What are some other things you're working on? You got dry needling, you got massage therapy, PT.
Yes.
What are some other things over there that our listeners can check out?
Well, so I am a MDT McKenzie certified, which I'm actually a back pain and neck pain specialist. And so I kind of branded it as a primary care of pain because I specialize in like getting to the root of the problem, which, actually a recent study, I think it was last year that came out, that said they looked at a really big population of people with like joint, shoulder, knee, hip pain, and 50% of them were spine related injuries. And so that's kind of like my wheelhouse of what I specialize in, and like being able to mechanically assess what's going on and finding the root. So it's kind of fun. And so I'm able to utilize that, my specialties with the dry needling, the soft tissue. We actually do a service where I will dry needle and they'll get right up off my table and go into the massage room. So the dry needling, we can get deep muscles with the needles, and then of course a deep tissue as well. And so it's been pretty fun, pretty effective too.
Yeah, I think a lot of people think, oh, my back hurts, I'm going to have surgery, right? And right, yeah, I think there's a lot of unnecessary probably back surgeries at times. And so...
Listen, I can tell you some horror stories. I actually recently had a patient who, I'm not kidding, 4 surgeries. And come to find out, it was 4 unnecessary surgeries. Like, she still kept waking up with the same pain, and it turns out it was coming from the neck, and
just radiating in the back somewhere, and
radiating down the arms and everything. And I was like, let's try this. And I mean, I knew what was going on. And so as she was, but she's resolved, and she spent, 7 years in pain for 4 surgeries, and nothing was fixing it. And now she actually painted a room, which I don't know if you've ever had like neck and shoulder pain in like painting, so that's like huge. Like she hasn't been able to paint, or like, she hasn't even been able to sit at a desk for 4 years, and she painted her.
Isn't that cool?
Yes. Oh, I love it.
Those are the stories. Yeah.
Well, that's why I do it. It's so rewarding. But that's why I was so fed up with traditional healthcare because it wasn't even about the patient anymore.
Right.
It was just pump out these numbers.
Yeah,
and
because we got to make profit, and we got to, although...
Which I understand. I understand. I need to put food on my table too, but that's not what it's about.
Right. We, at our real estate team, we keep coming back to, if we help enough people get what they want, we'll get what we want.
Yeah.
And we just love helping people get what they want. And then in turn, we make a fee for that.
Exactly.
And so
it
works out beautifully.
Yeah. Well, and actually, I will say that's part of the highlight of the McKenzie, in my treatment philosophy is that, my goal is to get you to be able to treat this on your own, so it's like a simplified 4-step process: abolish the pain, maintain the reduction, recovery of function, like get back to doing life, and all the while educating and preventing, because back and neck pain is going to come back,
It can, for sure. Yeah, if you don't change something.
Yeah, exactly. But so my goal is to teach you how to manage this.
Mm-hmm.
So when it does flare up, you know what to do. You're not having to, although I love seeing my patients, you don't have to see me 3 times a week for the rest of your life.
Right.
You know what I mean? Or, keep coming back for the same thing over and over again.
Yeah.
But I believe if you teach the patient how to manage it themselves, they're going to come back for something else.
Yeah. And sometimes it's just recovering from a surgery, because you did have an ACL tear.
True.
And you had to have that redone. And so you guys are fantastic about working back, getting that strength back.
Yeah.
Where you feel good about trusting your body again. And I'm just like, our friend we go see, it's just been great. And you're just like, I didn't even know you guys did all of this. So
I know. Well, I can't tell you how many times people are like, oh, you treat this? Like, migraines.
Yeah. I tell people to go before any, go check this out first,
mm-hmm.
Or go get a massage first. Or,
yeah.
I think there's a lot of things that people just don't try. They're just like, no, we need to go to the doctor. And then boom, you get prescribed something for the pain. And it's just masking it.
That's like, we have what's called direct access in Tennessee, where you can go to a physical therapist off the street, as long as they have the certain requirements, doctorate level education and all that kind of stuff. But nonetheless, like, we're trained as like, primary care level for pain. And so that was my primary, like, let's start at like educating the public, like when you're hurting physically, go see a PT, you know what I mean? Because otherwise you've got the primary care, they give you steroids. Then you go to, if that doesn't work, 4 weeks later, go to orthopedic, they x-ray this, try some more steroids or whatever, injection. And like, I call it the healthcare hamster wheel, where you're just spinning. Meanwhile, you're still hurting.
And that's weeks to get in.
Yes. Yeah. But so if you go to a PT first, they can, and that's the thing, we can evaluate, and I can actually, like, there's been times where, yes, this is musculoskeletal, like we can fix this, or that's a red flag. That's actually, that could be cardiac related. That could be something else. You're going to want to go back to your doctor. Yeah. So we can actually evaluate that kind of stuff. And that the McKenzie model, their evaluation system is really good about being able to pick up that stuff. So
that's cool.
It's kind of nice. Yeah.
Yeah. Yeah. I've got a good friend who's a chiropractor too. And I think they're overlooked a little bit as well. They're just wonderful healers. It's pretty cool. Yeah. So I think, how do you guys work with chiropractic? And then I think there's a lot of Eastern medicine too that we've, like discarded as earthy or hippie or, oh, that's just nonsense. But I think it's a lot, they've been doing it forever and it works. So
that's
kind of like, yeah.
That's true. Well,
so I think there's a whole holistic side of it as well that's very integrated, and it should be.
It should be.
Yeah.
Well, it's a team approach.
Yeah.
Like I have a lot of several chiropractors that we refer back and forth to each other, because they complement well. It's all about like maintaining the wellness and the health care in general. So, it's a team approach, and actually dietitians. So there's been so much more recently, that I've been seeing in the last like 5 years that, I think nutrition is a huge impact, like especially with tendon health and muscle and joint health, not just the big ones like preventing osteoporosis, but tendon ruptures in 20-something-year-olds who are young and active and healthy, I've been talking to a lot of my dietitian friends.
And you're like, wow,
what's going on there? Yeah, there's something.
What would you think is the root cause of that?
I think
on
it's
the dietary.
Yeah.
So what, any specific?
No, that's why I refer to them.
And what do they say? Do they know, or is it just, it's refined sugar, it's refined flour, or no, it's soda? I don't know.
Well, it's person specific. They kind of dive into that like mineral specific, but I think it's the food.
Yeah, lack of a lot of good minerals, and or
the chemicals in
or the bad stuff that's being added in.
That's just my like tinfoil.
No, I'm with you. I think there's a lot of bad stuff out there. I'm pretty encouraged about our new director of health, so we'll see.
For sure, I know.
I think he's anti all that stuff. So
right. But because just in the physical health that I've seen, so I started PT school in 2008, and so 15 years, math is hard. There's just the trends that I've seen change over the years, and I never used to see these kinds of injuries before that I'm seeing now. And the super sad thing is, I'm a back pain specialist. And, all the research, all the literature always says that if a child below the age of 12 has these types of back pain symptoms, immediately refer to the pediatrician. But I'm seeing so many kids under the age of 14 with mechanical back pain problems a adult would present with.
Is it just because you're sitting around all the time?
That, and I think also the foods we're eating and stuff like that they're on an elemental level look different, I guess. I don't know, but it's the strangest thing and I feel bad, but we treat them. I treat the kids like I would an adult, but that's not typical.
Yeah, and then maybe the dietitian can step in and make sure they're getting all the nutrients they need.
But it's a team approach. And I think you'll get optimal results when you do utilize.
Right, I think it's great. I think that's a great perspective too, because you're not an island. You don't know everything, right? And so you're like, hey, I know this guy. He'll help you out with that, and this lady would be fantastic for this. And I love the team approach. And
it's I've since opening my own practice, even when I was. Because I was in management in the mill, corporate world, you would do some marketing, but their marketing was so different. It was always doctors, market to the doctors, but I wanted to reach the community directly because I think that's important. Educate the community first.
100%.
And so through that, I've been doing a lot of networking in the last we've been open for 4 years that, it's been nice to meet everybody in the community and know what they do and, create this local.
Yeah. And then in turn, you go, oh, I know somebody who needs their amplifier rebuilt. I'm just looking at an amplifier over here. And then you're like, yeah, I know Larry down at whatever. Yeah. So it's, again, we're just people helping people.
Exactly.
Taking care of the community.
Right.
Which is what we love.
For sure.
So you grew up in Cleveland. How did you find your way into PT realm?
So it's kind of funny because majority of PTs are there because they had an injury and experienced it themselves. Truthfully, my best friend from high school, we got out of high school. She went on to be a medical assistant, and I was just doing I was a fine arts major, concentration in dance. But I realized that's not going to afford the lifestyle I was prepared to live. So it's we need to find a different profession.
Yeah. It's 0.1% can live off of the income off of that, right?
I was not that good. But so she was like, you'd make a great physical therapist. I'm like, I don't even know what that is. Sure. And when I looked into it, it was, exercise, but a lot of science behind it, which I loved science. And I was like, yeah, sure, why not? And so on a whim, my neighbor was from Gulf Shores, Alabama, and she was a PTA.
Okay.
And so she was like, oh, you should go. There's a program down there. So I just up and left and moved to Mobile, Alabama.
Good place to go to school for a couple of years.
Oh, I know. It's nice on the Gulf Coast. But finished my bachelor's there. And then at that time, it was an interest back in my day. It was not all programs were doctorate programs. So there was still a lot of masters. It was only about 50-50.
Okay.
And so I was like, well, if I'm going to go to grad school, we're going all the way to get my doctorate. Yeah. So, but Ohio didn't have one. So I wanted to stay in the Southeast, and ETSU's program was very highly rated. 100% pass rate, which was unheard of South Alabama, where I graduated from. I don't know what theirs was, maybe 80. And so,
is that because they care about the students so much and making sure they learn the concepts and that kind of thing?
I think so. It's maybe a smaller class size setting, but I mean, their pass rate was one of the highest that I saw. So I'm like, yeah, we'll stay in the Southeast. I like there. But, I don't believe in coincidence anymore. But Eric, my now husband, we were dating at the time, his grandma lived here.
Oh, that's cool.
I had no idea. So I just applied to that school, and he had been coming here for years for like a week at a time in the summer to spend with his grandma. And it was funny because he said, he chose ETSU. He didn't want to move to Alabama. And I was like, oh, we don't have that choice. But yes.
Yeah, right.
Yes, he did. So it all worked out. Yeah.
That's cool.
I know.
I love it. So what do you guys love to do for fun in Johnson City, you and Eric and the kids?
Oh, well, he's a firefighter, so he's an adrenaline junkie.
Oh, wow. Yeah.
And so we love the lake. The kids wakeboard. He wakeboards more than the kids, but I try.
Yeah. It's hard.
It's hard. I mean, I'm fine. I'm good.
Yeah.
But that's, he's, flipping around and everything like that. And it's cute. The kids are, doing it now too. So we love being out on the lake, outdoors. We have 5 acres. So we, messing around out there.
Chickens, goats, all that fun stuff.
We keep trying. It's not, we did ducks, we did chickens, tried ducks again. And,
we have lots of people move here and they're like, oh, I want the mini farm and I want 5 acres and I want to have chickens and goats and raise my own cows and milk the cow and all that stuff. And I'm like, okay, let's go for it.
You can do that.
Yeah, sure. I go, but it's probably not going to work out so good, but just enjoy the land and,
Yes. I try and garden.
When the chickens start attacking you because they're trying to take their eggs. And
yes, that was not fun.
Yeah.
Not fun.
So what was your first job you ever had?
So I worked for Wellmont back in the good old days of diversity in healthcare.
Yeah.
So,
like this was your first job ever? Or did when you were in high school you didn't work at McDonald's and flip burgers? Or
I'm sorry. Yeah.
Let's get the origin story here, Katie. Let's go.
All right. Well, I'm sure statute of limitations have expired on this, but I was working way before labor laws would allow.
Same. I was mowing yards at 14.
Right? No. So my dad owned a grocery store.
There we go.
And so I worked my way up from the packer, packing up the groceries, taking them out to the cars, to cashier. And so, I worked there.
Did you do some stocking, put the cans up?
No, they wouldn't let me.
They wouldn't let you do that.
No. But I'm one of 7.
You seem like you you keep all the labels pointed out. You seem pretty, detail oriented, I would think.
Yeah, well, no, not back then. I wasn't.
Okay, gotcha. They're
that was a learned.
They're all upside down and backwards. Okay, you need to just go bag and carry.
No, I was that cashier, just throwing things down. I had no concept of produce bruises.
Yeah.
So there, so I worked well before you should. So
that's good.
I think it was 14. He would, drag me out on 6 a.m. on a Saturday morning to go work at the grocery store with him. But then, in high school, I loved working retail.
Yeah.
So I did a bunch of retail jobs. I don't think I would be really good in a restaurant setting. I'm too forgetful. Walk into a room why am I here? And I was back then. Yeah.
What are you doing here? Oh, you're here to eat food. Okay, I got it. I got it.
I don't think I would have done well in those settings. So I didn't. I worked retail.
I think retail is good for people. I think I tell my boys Cameron's been working quite a bit. Christian, I told him he needs to find a retail job where he's interacting with people because I think it's highly beneficial because you got to talk to people.
Oh yeah.
I worked a telemarketing job for a while and it was good for me to learn how to overcome fear and talk to people. Yeah, it was really good.
Oh, yeah.
Luckily, it was call in. They were calling in to order stuff. So I wasn't like now.
You weren't cold calling.
No, but I still do it today. I'll call and be like,
true.
Hey, do you need to buy or sell a house?
Yeah, it was a learned skill.
Yes.
I will say in college, I kind of got into teaching group fitness, which was so fun.
Yeah.
Which obviously helped transition to PT,
right.
what I do now. But and I was a Zumba instructor far before it was like a cool, I think back in the day, there was only like, 2 here in Johnson City. And
I think there was a Zumba, yeah.
And so I moved here and...
or there was classes in the gym. Like it may have been a Zumba, whatever. But
but it was fun. So
yeah,
taught that a little bit in, while I was here in PT school.
Yeah, I think let's talk a little bit about working out because it makes you feel great.
Yes.
What are some things for our listeners? Like how much should you work out if just to stay like healthy and, but then obviously you can go over, but like on average, like if you're not kind of getting after it a little bit, right, every week, you'll start going downhill, right?
Yes.
Our bodies are made to work.
Gosh. Yes. Yeah. In fact, our backs love to move.
Yeah.
Like that's when you're going to be the healthiest, the strongest. I mean, it's different for everybody. So it's really hard to say,
I think it is different for everybody, but I think everybody should.
Absolutely. Everyone should move. Majority of the days of the week.
Yeah.
Absolutely. Whether it's, light exercise to strength training. But that's the thing, like, I really think people need to, increase frequency, but intensity doesn't have to be very high. You know what I mean? So, like, you don't have to be like, when I think of intensity, you think CrossFit.
Yeah.
It doesn't have to be like that 7 to 6 days a week.
No.
But you definitely need movement in general. Like, we're not meant to be sedentary. And so when we are, that's when more problems arise. So, but I will say more about diversifying your workouts because the body adapts how you train it.
Sure.
And so actually one of the key features of what I do is, I believe in strengthening from the inside out. And so it's funny because I'll get like these giant bodybuilders who can like bench press 450 or whatever.
Right, they pick up a car.
Exactly.
But they can't tie their shoes or whatever.
Exactly. And then I have them do like, a simple like core balance exercise and they can't do it. They're shaking after like 10 seconds. And so, I really preach that you also need to train the little muscles, the stability muscles, because they actually operate and work differently than the big movers.
Yeah.
But strength training is so important for structure and stability. But also moving and functioning like as you get older. So you need a little bit of everything.
And you can do a lot of it just body weight, like push-ups,
Absolutely.
sit-ups, squats, you can do some yoga stretches.
Absolutely. Yeah. And and stretching, like, people think stretching has to be this involved routine where you have to like set aside 30 minutes, stretch, hold all these stretches. But realistically, moving to the limits and like making sure that you're moving within your full range and just maintaining that is so important because otherwise, if we start to lose it, that available range gets shorter and shorter. And that's why that's why as you age, they start to
hunch over,
migrate down. And there's more to it, not always. It's hard to say like for sure that's why. But yeah, really maximizing your range of motion while strength training, while exercising. And it doesn't have to be like static stretching, like,
just the really non-fun stuff. Yeah.
Right. Yeah. And actually I've seen, I did this little program with the strength training and actually I saw more hamstring flexibility after I did this program of like, there was some like single leg deadlifts, than I did when I was dancing in ballet. Cause, I stopped dancing for a while and then, my flexibility wasn't great, but I did that program and we weren't stretching, but I was loading and lengthening and I actually saw more gains in flexibility than I did when I was stretching. So it's very interesting. You can achieve a result with different methods.
Yeah.
You know what I mean?
Yeah.
And so I think it's more about diversifying. I highly recommend, do you strength train? Do you work out?
I haven't.
Putting you on the spot now.
Yes, I have been out of the gym for the last few weeks because I've been on the DL, but yes.
I'm sorry.
That's okay. But yes, I do like to work out.
I recommend, if you're a lifter, power lifter, or even if you're like more about the machines, take one day and do a stability day. Work on, arm stability, like
a holding plank kind of thing?
Well, not necessarily holding, but like inchworms, where you're like walking.
Oh, yeah.
Load the shoulders, body weight, We
do all kinds of crazy stuff in the classes when I go. Like we'll do bear crawls across the floor and back.
Yeah.
We'll do, crab walks where you're backwards and up. We do all kinds of weird stuff to keep it interesting. So.
Oh, that's fun.
Yeah, it is fun. Sometimes when you're like, this is the worst thing I've ever done, it's not fun at all.
Yeah. But you're glad you did it afterwards.
Yes. And I think it's helped a lot. Although I've been dealing with some plantar fasciitis, which has been brutal, but it's getting better. So I'm excited about that. Yeah. But I think people get complacent or they get in their routine and they're like, I'll work out sometime. I mean, I kind of miss it because I haven't been, but I'm watching myself feel weaker, get weaker, less motivation, less energy. It's crazy. You wouldn't, it's kind of counteractive. If I go burn a lot of energy, then I'm going to have less energy, right? It kind of, revitalizes you, and then you can carry it out through the day too. So it's good.
Yeah. And honestly, it doesn't have to be a full hour and a half, workout. Just go walk.
Yeah.
You know what I mean? And listen, where we live is increased intensity just by the incline we
just
have.
Just because of the hills and down sometimes going down a hill's hard.
True.
Yeah.
Oh, yes.
Especially if it's up on the mountains with all the slippery rocks and stuff.
Oh, yes.
Yeah. But that's good for you for business. People come in after that and they're like, I'm sore and tired. Yeah.
Exactly. And I think trail running is, a new thing right now because I'm seeing a lot of that.
Oh, okay.
I'm not saying it's the trail's fault, but,
What do you think about, I'm seeing a lot of cold plunge therapy, a lot of cryotherapy, that kind of thing. What are your thoughts on?
Yeah, there's benefits for sure. But
I'm in my brain, heat if it's open and warm, then blood flow gets to it. If it's cold and constricted, there's not a lot of blood flow. Blood flow brings healing potentially. It's kind of my thought on that.
Yeah.
I was talking to my coach the other day about it a little bit. But you're saying there's benefits. So tell me the benefits.
There's some benefits. But I will say, the interesting with cold is, yes, it's a vasoconstriction at first, but once you warm up, it's almost a rebound effect.
So it's
because if you put a hot pack on you, or, a heating pad, and you take it off, your skin's red.
Yeah.
If you put a cold pack on your skin, then you take it off, do you notice?
That's red too. Red? Yeah. Because it's we got to heat that up.
Exactly. And so, but, there is some benefits to, now, I do not know or want to sit in a cold plunge for more than a minute or 20 seconds.
Yeah.
I don't know. But again, there's,
different strokes for different folks. Yeah.
Yeah. And I will say there was, there's this breathing.
The Wim Hof guy. Yeah. He's awesome.
So my husband read this book and he was all about it. And he's like, this is really cool. And then, but actually there was a recent study that was
not so cool.
Yeah. Well, and it's funny because I'm also a little nerdy on research. So when I do read a research article, I'm picking it apart. But this should have been different. So that's kind of how I.
And it's one research article, not 100 of them. So you kind of got to balance that out, and then maybe this person had some sort of anti-Wim Hof. I don't know. You got to be. So you got to have a broad spectrum of it, because I think we in the news are just very quick to jump on I read this and that's the truth, and I read something else that's totally contradictory to that, and so
I know. Well, it's you can say this study said this because the one sentence said it, but then the sentence right below was but it's not really statistically significant, so we can't say that. So, they kind of take things out of context like everything else.
Well, and I think that, Big Pharma does a lot of that to get their, when you're saying, hey, this is going to make your hair grow or whatever, but then there's on TV when you're listening, and then there's 18 different side effects that, it may kill you, but at least you have long hair or whatever.
Yeah. Well, and, this is such not that we're taking a weird turn to politics, but the healthcare system in the United States is so different than it is anywhere else. There's so many good things about it, but, the drug companies, not many other places, they advertise to the patient directly.
Europe, totally not. They're what are all the drug ads on TV about?
And then so the interesting thing in New Zealand or Australia, or maybe both, I can't remember, but the healthcare system, physical therapists they call them physiotherapists, are actually more regarded as a primary care specialist. And orthopedic surgeons actually market to them saying, send us business because they're the first line of defense for musculoskeletal
Yeah.
issues.
Well, it makes sense. Yeah.
But here it's like, especially, and I don't know, I can't speak on other areas, but Johnson City, especially, the tradition of medicine is always go to your primary care first or go to the orthopedic surgeon office first, not us, and so it's an interesting dynamic. I'm trying to change that though, Colin.
I think, and that's why we're here, Katie.
Yeah.
We're on talking to everybody about it. I think it's a great place to go first. Or like before PT, I started going to, we have a primary guy, the black bag doc, who's concierge.
Yes.
Dustin Clark, giving you a shout out, bro. But we also went to our friend Richard Ballard, who's an unbelievable chiropractor. And so, yeah, he's fantastic. And so I'd go, Richard, what's going on? He's like, well, and my brain says, like, we have bones, obviously, but that's just kind of the internal structure. All the muscles and tendons and nerves, all that's holding that together and holding it up and making it work. And so I think, we look at, we just look at the body in a different way. But that's why I love massage. I love PT. I love holistic kind of ways of doing it.
Yeah.
And yoga even can help out a lot.
Oh, yeah.
Yeah. What does the future look like for Homefront?
Well, my vision since day one was to change the face of healthcare. So I plan to grow and expand, hopefully into other areas, not just physical therapy, because, my mission is all about patient-centered care, superior quality, just being able to do what's right, what's best for the patient. And so, I plan to expand beyond just what my little hands can do.
I like it. And then teaching other people how to do it well, and then maybe franchise model a little bit, maybe.
Yeah, as long as it doesn't water down the product.
Yeah, well, I think if you're you have strict standards on how we operate at our Homefront offices. And this is what you can expect if you went here or you found one in Texas,
Yeah, exactly.
Just that's you being the leader there, for sure.
Yeah.
All right. We're going to jump into a little speed round a little bit.
Fun.
What's your favorite place to get a cup of coffee? You said you weren't a coffee person earlier.
I'm a tea drinker.
Where's your favorite tea house? Or where do you like to get a cup of tea?
Oh, Stillwaters.
Yeah.
Yeah.
And Gray, I
love them.
They are so good.
And I'm a strong tea drinker, so they steep it a little extra for me. So.
Oh, tell me what type of tea do you like to drink? Like where?
Earl Grey.
Yeah.
Is my favorite. But I'll do Irish breakfast for the caffeine. But now I drink tea like some people drink coffee, like high octane, strong, black. I'm 3 tea bags for 1 cup.
That's pretty strong.
That's very strong.
Yeah. No cream in there? No London fog?
Nope. My great grandmother and, my grandma spent a lot of time with them straight off the boat from Ireland. So their tea was always really strong. And
I grew up on tea. My mother's English, but we'd put a little cream and sugar in there and made it really lovely.
Yeah. It does taste good. But
Yeah. Okay. So you and Eric are getting a pizza. Where are you going to go?
Sims, usually.
We love Sims.
I know.
Dollar Slice night. Go ask for my buddy Hardeb. He's on our real estate team. Super good dude.
Yeah.
But the pizza's just great. Dollar Slice night. How can you beat that?
I know.
Yeah. Actually, don't go because I don't want a lot of people there because we have to wait sometimes.
I know, right? There's not a lot of seating, too.
You guys are going to go on a date. Where do you like to go?
Oh, gosh. We don't get to do that often.
How old are your kids?
11, 10, and 6.
Okay. Yeah.
Yes. And where are we going? Gosh. I love Cafe Lola. I've always loved Lola.
Yeah.
Gourmet's good.
Carly, my wife, loves Cafe Lola, too. It's a good spot. And Gourmet's great. Fantastic. What is your favorite Christmas tradition that you guys do?
Oh, Christmas tradition. I just love big family dinners.
Oh.
We don't have any family here, so I'm always friends, come on, gather up.
Hey, you guys having dinner over there? What you do?
Yes, but we do a surf and turf. So
nice.
We'll do some kind of beef steak or whatever. And my mom is from Maryland. Well, she was born in Maryland, but we make Maryland crab cakes.
Ooh.
So legit crab
Those are
cakes.
so good. And I bet yours are really good. We had some the other night at Bonefish, and they're good, I think.
Yeah.
The remoulade is just...
I was going to say, but there's a lot of breading in that, you know. These are like...
More crabby than...
Oh, yeah.
Yeah.
Just enough to hold it together.
Yeah. I love it. What are you working on or studying right now? Anything personally that you're like, I'm trying to get this?
You know, so I'm a McKenzie cert, and then the next is like kind of like, I guess, a fellowship equivalent, a McKenzie diplomat. But, you know, I'm constantly doing like continuing education more than I need to.
Yeah.
So
same. I still had to bang out some hours for this year, but
yeah.
I think that's good.
So yeah, I'm thinking about going on to my diplomat. So it's just a higher level.
And then you're president after that.
Yeah, exactly.
Take over the world of McKenzie studies.
Yeah.
And what's something I forgot to ask you that you wish I had? Like, is there anything you're like, man, I wanted to talk about this? And if you're in my shoes, or you can turn the tables and you can ask me questions. Sometimes our guests do that too.
Oh, okay.
Yeah.
All right. What is one thing you wish to change about Johnson City?
Wish to change. Ooh. Currently where I live, we have to go through a 1-lane tunnel.
Oh, yes.
So that's going to change. It is on the books to change. So I'm praying.
Does that does that tunnel have a light associated with it?
It does. It used to not. Like when I grew up, we came, because I lived on the other side of the tunnel and drove by where our house is all the time.
Yeah.
And you just would look kind of through and nope. And it worked fantastically. But then they said, no, that's not working fantastically for some reason. And we're going to put in a light on both sides. And I think that really kind of messed it up.
Especially, I mean, I think after 4:00, don't go that way.
Yeah. And then, but you can't go, I mean, it's hard to go any other way. And then you come around the other way and you get stuck. So I'm hoping to change that.
Good.
And I don't think that's going to happen until 2026/27, I think, somewhere in there. I think, we still don't have enough adequate inventory for all the people moving here. I think the Lord is calling people here to East Tennessee for a reason. Like, I think because we love each other so much and we're such just a community where we take good care of each other. It's just, anytime somebody moves here, they're like, oh, this is unbelievable. Like, I heard about it, and then people are actually like, they care, and they're like, come check on me, and they're like bringing me food and stuff. It's just, I think it's the way it's supposed to be.
Mm-hmm.
And so I don't want that to change. I want that to continue to grow. And so how do we do that? I want to see more people come to know who Jesus is and love people the way he does. And it's just, that's what we're called to do as believers. I know you said you were. And so I think, breaking down a lot of the stereotypes there too. And there's a lot of people that don't believe and think that it's really bad for some reason, but but you're like, you know what? Somebody, like, for your side of it, and me too, like, somebody created us. Mm-hmm. And I think to consult the creator about your body is a huge thing too. So, like, not only are we going to work on your knee, but we're going to pray about it, and you can pray about it. So that's kind of part of it.
It's funny. I just, I gave the speech for, the DPT's hooding ceremony. And
Nice.
That's actually what I said to them. I said, hey, by the way, don't forget to ask God. After all, he is the manufacturer.
He created it all. Yes,
he did. Now, I've got one more question for you.
Yes, ma'am. Hit me.
If you could be a character in a movie or a TV show, who would you be?
Right now, I would say I want to be Buddy the Elf. Smiling is my favorite.
Yes.
I want to go through the candy cane forest. And no, I'm just kidding. But we love Elf. Oh, my gosh. It's such a good movie. And there's a lot of life lessons in there, too. It's just so good.
Yes.
Just be joyful and love people and,
Love it.
Yeah. Thank you for asking some good questions.
Yes.
Okay. How can listeners connect with you online? Or maybe you're in pain right now and you're like, I want to go.
Give us a call.
Yeah. I want to go get worked on.
Yeah.
Get taken care of.
So we have a website, homefrontpt.com. Or we're on all the socials at Dr. Concierge PT. So Facebook or Instagram.
Gotcha.
But yeah, it's super simple. You can book right through the website.
Okay.
And, or you can call the office, of course, but.
Let's say your knee hurts right now. How long do I have to wait to get in there?
I've got some openings available.
Look at that. You can get right in.
Yes, you can get right in. But, I will say we tend to, we've got a full caseload, but the good news is I'm flexible with my schedule and Jess's schedule as well. So
cool.
Yeah.
All right. What gets you fired up? You're just like, oh, let's go.
You know, seeing the fruits of my labor, like, you know, when a patient, I was telling you about the girl who painted her room, you know, or, you know, the one I saw was seeing one guy concierge and not now Jess took over, but, you know, he, you know, getting out up and down without any help and stuff. Like, you know, just like things that like
people can't walk and they're like,
that you could walk and you're now driving. You know what I mean? Like, it's not just you met expectations, you blew it out of the water. Oh, that just blows. I mean, like, I tear up with my patients when they like are telling me about this stuff. That fires me up. And my kids and my husband. Oh my gosh, I love them.
Yeah. Yeah. Same. Carly and the boys are just awesome.
Yes. I know.
Well,
it was so sweet. I got to chat with her.
She's gold. Yeah, I'm glad. She'll be excited that you got to be on the podcast.
Yes.
Well, thank you for coming on. Thank you for sharing all about your life and your business. And I'm sure the listeners are enjoying getting to know you. And then hopefully they'll come visit and you can take great care of them.
Yes. And you don't need to you don't have to have PT to get massage. You can just.
That's right. You can just come get massage. Side. And maybe even, you know, be ahead of the pain, you know.
Exactly.
Like, how often people probably, you know, they're like, oh, massages, that's a little funky, whatever. But how often should people get massages? I mean, like, it's therapeutic.
It's super therapeutic. And, you know, I mean, you can prevent a lot of things by general self-care. So, I mean, if you don't want to end up on my table, go to them.
Right.
But it just depends. I mean, if you are doing it and you've got some issues, you might want to be a little bit more frequent, like every 2 weeks for a couple months. And then you can probably go every once a month to every other month.
Okay.
But it just depends on where you're at.
Yeah.
So.
And can they log on to your website too and get booked for massage there?
Yeah, absolutely. Everything's like.
Talk about those fees a little bit, just for people.
Massage 60-minute is $95 and 90-minute is $125, I believe. And we've got a different specialties. So prenatal, April, one of my massage therapists is a doula. So she also specializes in prenatal and postnatal. And then TMJ, she was a dental assistant as well. So she does some TMJ work.
Isn't that crazy? Like, I think a lot of people go, no, it's just a tooth or something. But no, there's a lot of.
Oh, yeah.
And a lot of, just a lot of pain from TMJ.
Yeah. And then Justin is, you know, I joke that there's deep tissue and then there's deep tissue. So like he can get pretty deep. So, you know, he's great.
And I found that's what I enjoy is where somebody's just like, and you're kind of like, I mean, I've had to I'm like, Ryan, we're not going to be friends after this, but I know it's helpful. You know, so
you do. You're friends after. It's okay.
Yeah. Well, and he's getting blood flow to those pain points that are deep within that tissue. And so, yeah, he's straightening out my Twizzlers.
Phew.
Yeah. So, well, thank you again.
Thank you.
Merry Christmas.
Merry Christmas.
So next time, I'm Colin Johnson with the Colin and Carly Group and Keller Williams. If you want to move here, obviously, we would love to help you do that. We've helped thousands of people do it, and we'll take great care of you. If you want to build wealth in real estate, you need to look at doing something like that, Katie. We'd love to do that, and you don't have to manage it. We can do it all for you. And so,
You need to buy a building.
There you go. I'd love to help with that. So thank you so much, and Merry Christmas. Until next time, I'm Colin, and this is Katie.